Everyone, welcome. Thanks so much for coming. We are really excited to get to share all the work we've been on. If as you're coming in, you can introduce yourself in the chat, share your name and where you're joining from. We would love to say hi. Harlan, it's so good to see you in here. Thanks for joining. Another from CNS Healthcare. Jennifer Phillips, it's so good to see you. You're our biggest fan. We've got folks from the other side of the country in San Francisco and in Oregon, Michigan State Budget Office in Griffin Place. Thank you all so much for coming. We'll get started in just a few minutes. Some more Michiganders coming online. Lindsay from Missouri. As folks are coming in, if you can introduce yourselves in the chat, we would love to hear where you're coming from. We'll get started in just a few minutes. Idaho Healthcare, Zach, thank you so much for reaching out to us and thanks for coming today. Just gonna wait a minute or two more and see who joins before we get started and introduce the team a little bit. Awesome, some more West Coasters. Thank you so much for joining. We're really excited to share about our community partner strategy and updates to the application templates that we made based on the CMS IFR. You want to get up and stretch a little bit. I don't know if you've been back to back today. I have a little bit, so please feel free to just get a little stretch in, shake your body out before we share a lot of content and have hopefully some really robust conversation. Okay, we're almost at the 50 person mark, so we will get started. Thank you everyone again for joining. As you come in, please continue to enter your name and where you're coming from in the chat. We'd love to know where folks are coming from so we can just continue to iterate on the content as we share with you to make it relevant. My name is Rachel Rosenbaum and I'm a design lead here at Civilla, and I'm really excited to introduce the team to you. Before we do that, just want to say that we had over 100 people register for today's webinar from across the country. We even have two folks joining from India. And we are, for those who don't know us or aren't familiar, just need a reminder, we are a nonprofit design studio that has been working with our public serving institutions to design human-centered services for over a decade. We've worked with Michigan, we've worked with Washington, we've worked with Connecticut and Missouri, and a lot of folks in between across a whole variety of sectors. Today, we'll talk a lot about benefit access. We've also worked with DMV services, with unemployment insurance, and a whole variety of other institutions. And like we imagine you believe, since you're here today, we believe that a more beautiful civil society is possible. And we know that there's people working every day to make this possible. People like you who care deeply about folks that are impacted by new policies and want to make it easy for them to navigate them. And we really hope that today's research can inspire and spark change in your work. So before I introduce the team, I just want to take a moment to thank the Michigan Health Endowment Fund. They were funding the work and such an important collaborator in helping us do this work over the last few months. And so we are super grateful for their support. we're going to share a lot of content, but we'll also save about 20 minutes at the end for question and answer. So please feel free to put your questions in the question and answer function or in the chat. As they come to you, our team on the back end is going to be capturing all of them, and then we'll use those to get the conversation started at the end. And without further ado, I think I will turn it over to my teammate.
Hi, everyone. So nice to meet you. I'm Vidisha. I'm a senior designer at Civilla.
Hi, everybody. Thank you all for being here. I am Ciandra Brown, and I am a researcher designer here at Civilla.
Hi, thanks so much for being here today. My name is Kayla Guillory, and I'm a senior designer here at Civilla.
Hi, everyone. Welcome. My name is Sam Brennan, design director here at Civilla.
Thank you so much, team. And yeah, thank you so much for joining us today. I'll first start with a little bit of context on the project and what we shaped our work today. Then we'll walk you through the two main streams of work. So the first one is communication and digital tools we created to support residents and community partners as they navigate the new work requirements. We'll also be sharing the updated application template, as Rachel mentioned. Some of you might have seen the first version of those templates in our last webinar. And since then, the interim final rule was released on June 1st. So we made, and we'll share updates of what we made in response. And we'll have, as Rach mentioned, 20 minutes for Q&A. And then we'll be sharing all the resources with you so you can explore and adapt them after the session. Okay, before we jump into project details, we wanted to start with a story that really grounded us and ultimately reframed the work for us. And as we're doing research with community partners, we began to better understand just how much responsibility they carry when policies change and how often residents rely on them for support. So this story that really stayed with us was Megan's story. She is a program manager and she's been supporting low-income families for over 20 years. And she helps them apply for benefits and manage benefits. When she starts hearing about any policy change, she starts to she becomes really proactive. She starts to research about it, begins reading guidance, following updates, talking with peers, and creating materials to prepare her staff. She does all this because she knows what happens next. As soon as residents starts to hear about the policy, many of them starts calling her and started panic asking about what this means to me. Will I lose my coverage? And Megan and her team are often the first people helping residents understand what is happening and what they need to do next. But she also described that this preparation is really exhausting for her. She's often piecing information together before any official guidance is clear, creating materials from whatever she can find, and trying to really prepare her staff while she's still unsure if she has the most current or accurate information. And Megan's story really reflected something we heard throughout our research is that when policy change reach residents, community partners often become the frontline support. And community partners are the ones who are translating this policy to personalized guidance. They are especially important for people who may or may not be able to self-serve, whether because of disability, a language barrier, limited access to technology, or simply because the policy is difficult to understand. And community partners are often the people receiving these calls, sitting down with the residents, and helping them understand what the change means for their household and what they need to do next. So they are doing all of that with limited time and capacity. And this is what makes their role so critical and why supporting them became really an important focus of our work.
And that is why the goal we centered around was to develop human-centered, actionable resources that states and community partners can use to meet the implementation deadlines, reduce the burden on staff, and help millions of residents maintain healthcare coverage. I want to just shout out again that these resources were designed through the work we conducted in partnership with the Michigan Department of Health and Human Services and with funding and collaboration from the Michigan Health Endowment Fund. But yes, back to the goal. As we all know, states are taking on a significant amount of work in a very short period of time. They're trying to implement new systems, update processes, train staff, and communicate to residents all at once. So the goal behind everything we built was to make that easier and more actionable for states, community partners, and residents. When states are unburdened and resources are more human-centered, everyone benefits. Staff spend less time answering the same questions repeatedly, community partners feel equipped rather than overwhelmed, and residents are more likely to stay covered because they understand what's being asked of them. So to build things that we actually can deliver on, we had to start by understanding what residents and community partners needed, which is what this research gave us. So we did a lot of research that led us to the work that we'll be sharing today. First, we sat down with 5 different community partners from 3 different organizations in a co-design session here at the Civilla studio. And we just wanted to understand what they were already navigating and what they actually needed. And then we tested with 34 residents and 9 community partner staff across 43 sessions total. And we made sure that we had a diverse representation in testing. So we made sure to test with people who have a variety of work situations, family sizes, ages, races, and health statuses, as well as community partners who work with a variety of communities, such as immigrant populations, disabled populations, and people experiencing homelessness. And we just did this to ensure that we're designing for the range of people and community partners who will encounter these requirements, including people whose circumstances might make compliance a little bit more complicated. So looking across both the resident and the community partner research, we identified 3 core needs that guided the designs that we'll share today. So the first core need was to have a single, reliable source of truth. Residents and community partners told us that when policy changes begin, they often have to piece information together from many different places. So they're going to social media, a news article, different advocacy organizations, and even conversations with their peers. Official information might come later, and that gap can create a lot of different anxiety and confusion for people. But people are trying to make really important decisions without feeling confident that they have the full picture. The second need was for community partners to be prepared and informed before the general public. So we heard repeatedly that community partners are often learning about policy changes nearly at the same time residents are. And what became clear is that they needed earlier communication, training, and practical implementation guidance so they can prepare for the questions that follow once resident notices and public announcements go out. And the third need was a way for residents and community partners to understand how a policy change applies to an individual situation. These policies can be really nuanced and difficult to interpret quickly. So residents need clear, personalized information about what applies to them and what they need to do next. Community partners need tools and guidance that can help them provide that same personalized support across many different household circumstances. So these 3 needs became the foundation for the tools that we developed. So now we'll walk you into these tools and just show you how each one of these responds to what we heard in the research. And we'll be starting with the communication and digital tools. So first, I'm going to share about the work requirements website that we developed. So as I mentioned earlier, a core need that we consistently heard from residents and community partners was that they needed a reliable place to find clear and up-to-date information. For most states, that's going to be their public work requirements website that will serve as an anchor for that. It's not only the place that people will encounter the policy, but it will give residents, community partners, and staff a shared place to return to and a shared language to reference. So today we want to share what we learned from developing and testing that experience with Michigan and give you all a set of design principles that you can apply to your own context. So these are the 3 principles that came directly out of what we learned from testing with residents and community partners. They're a reflection of what actually helped people understand their situation and know what to do next. Each one of these shows up in a variety of ways in the website, so I'll walk you through them all. So the first one is to help people assess relevance. Communicating the work requirements is not simply a matter of just publishing all the policy into one place. People need to find themselves within that information. So work requirements does contain a lot of conditions, exemptions, and reporting details. And when that information is presented all at once, it becomes really difficult to know where to start, what applies to you, and what you can safely ignore. Helping people assess relevance means structuring information so someone can get a clear enough answer to their immediate question without having to process everything first. They can then go deeper only where it matters to their situation. The exemptions question on the website is one example of that. Rather than making residents read through a whole very long, strenuous policy explanation, it leads you with the sentence saying, "You are exempt if you are." And then it lists situations that they can recognize themselves in. So the bolding that we did to certain phrases and this accordion structure let residents scan quickly and stop when they see something that represents their situation. And this just helps them identify, like, this is about me or this is not about me very quickly and clearly. So once someone understands where they fit within the policy, the next question was usually the same. Okay, so what do I do now? So that led to our second principle. That's making next steps very explicit. Understanding the policy isn't really helpful if someone doesn't know what to do with it. Residents who will leave this page with a general sense of how work requirements work, but no clear action, are just as likely to disengage as residents who never read it at all. And that means pairing every explanation with clear guidance about what a resident needs to report or do next, and doing that differently depending on where they are in the process. The anxiety of someone applying for the first time is different than the anxiety of someone who's maybe coming up on a renewal. And the next steps they take is different too. So treating these as very distinct situations rather than collapsing them all into one set of instruction reduces the chance that someone takes the wrong action or no action at all. So this section on the website about the 3 different ways to meet work requirements is an example of that. So we start with saying any one of these is enough. You do not need to make all 3 at the top, which is doing really specific work. It stops a resident from reading what follows as a checklist and reframes it as a set of options. Each pathway tells someone not just what qualifies, but as you can see at the bottom of the section, they're also informed on what they need to report and when. But even with very clear steps, we will still have residents who have very specific questions that don't always fall neatly into the page. And that's why our final principle is to organize around answering residents' questions. There's often a gap between how policy is written and the questions that people actually have when they encounter it. So a site organized around policy logic might make sense to someone who already understands the policy, but a site organized around the residents' questions will make sense to someone who doesn't. In practice, that means identifying the questions residents are actually asking and making those entry points into the content. It also means organizing by situation rather than category. So a resident or a community partner in a specific moment of confusion can find their or their client's circumstances rather than having to translate their situation into policy language first. And so the FAQ section that we design on the website reflects that. Rather than organizing by policy topic, it's organized by where a resident is in their Medicaid journey, such as being enrolled, a new applicant, or dealing with a missed deadline or potential coverage loss. And these questions came directly out of the resident research. As you can see on the right, one of the biggest questions we got asked, and probably most important question that residents had, was, will I lose my Medicaid coverage? And so when we tested the website, one resident had this quote to say, "This breaks it down very easily. I understand more of who needs to do the work requirements." And this is the outcome that the whole site was designed towards, giving residents enough clarity that they can actually do something with it and allowing for comprehension and confidence that can lead to action. So everything we just walked you through is available for you to use in your state and adapt and downloadable. So the 2 website resources that you can download right now are the content document. So this has all the text in a very editable form. So your team can update the program names, the dates, and the state-specific details. And we also have the HTML file if you want to look at it for visual inspiration. And so while this website will serve as the main source for very helpful information, we understand it can't provide every single type of support that a resident may need. Many people will still turn to community partner organizations to help them interpret the information, which is why Vidisha is going to take us through this next part of the work that focuses on preparing community partners.
Thank you so much, Siandra. The next part of our prototype is the webinar series. So in order to prepare community partners, we designed the webinar series to help support and train them. As you heard, the core need here was that to prepare community partners before residents are informed of the policy change. So if you think back to the Megan story I was talking about, she was spending weeks trying to piece information together on her own so she could be ready when residents start calling. So rather than designing a single webinar, we designed a broader communication and support ecosystem, and one that helps community partners just build their own understanding over time and prepare them before implementation. So what we created was a full strategy and ready-to-use materials that states can pick up and adapt. So the first thing you'll see on the screen is the strategy that gives states a roadmap of the series. So that basically has the purpose of each session, the research behind the approach, what to cover at each stage, and how the sessions build over time. And with that, we also developed the content itself. So you see the slide decks, the visuals, talking points, one-pagers, resident communication timeline. And so much of the core work is already done, which allows states to just focus their time on logistics, state-specific decisions, and adapting the material to their context. And all of this was developed in close collaboration with Michigan. So the materials reflect real implementation decisions and addresses the kinds of questions and things that was coming up in real research and conversations with community partner. The resident communication timeline, as you can see on the screen, was especially really important because community partners told us that residents often call as soon as they receive a letter, but the person supporting them may not know what the letter they're talking about or referencing about because there's less visibility about that. So helping them create that visibility when the residents call, help them just to be prepared rather than catching up in real time. So as we developed the series, we focused on two audiences with different but connected needs. The first one is supervisors and program managers. So they are preparing their teams internally. So they are mostly focusing on helping staff understand the changes and making sure people feel equipped to answer questions. And what they need is enough depth about the policy so that they can train others. They need materials to adapt and share, and clarity about what is still unknown so they can plan ahead. The next group is navigators and case managers. So they are the people working directly with residents every day. So they need more practical, actionable guidance and a clear understanding of how the resident journey will change under the new requirements, because they'll be the ones supporting and answering case-specific questions, and the policy may affect each individual household so differently. They would need to know all those nuances in the policy. So with those two audiences in mind and their different needs in mind, we designed the sessions to build on one another over time. So here's a quick snapshot of what the session arc would look like. So the first session is focusing on understanding the changes. So the goal here is to give community partners a clear picture of what HR1 requires, what decisions the state has made, and what residents will be asked to do. The timing of this session specifically is really important because it should happen before resident notices, flyers, or other public communications go out so that community partners can be prepared before residents begin coming to them with questions. The session 2 shifts into more practical guidance. So here it's focused on to help navigators and case managers understand how to support residents through exemptions, reporting deadlines, and the other day-to-day situations that are likely to come up. And the last one is session 3, which is basically a final touch point before everything, before the launch. It gives the state a chance to address any recurring question, share any final updates, and help community partners just like feel more settled and confident heading into implementation. And across all the 3 phases, we are recommending an ongoing support loop. We really heard that community partners will continue having like specific case questions that are difficult to anticipate in a webinar. And they need a place to come back to where they can ask these questions, understand, and get accurate answers. The exact format is something that will depend on each state and what is feasible for them. But creating that continued connection between state and community partners is really, really important. And again, all of these materials and what I've shared today is for you to use and adapt. I just want to quickly share about how we can use these templates to make it as easy as possible for you to adapt. So throughout the template, this is one of the examples of one of the slide decks we created. So there's two types of highlighted content you will be seeing. So anything that is bracketed, that's highlighted in yellow in color, that's something state needs to change. So those are mostly like proper nouns. So that's state agency name, Medicaid program names, or other state-specific terminologies. So these items are consistently marked throughout our slide decks and all our materials, so states can quickly find them and replace them throughout the deck. The content that's highlighted in green in the picture here is a little different. So these are confirmed Michigan's policy or process decisions. So for these sections, the guidance here is to read the comments you can see on the right, and so that explains the reason behind the decision being made, so that states can first confirm that their policy is actually different before changing it. So the goal here is to make adaptation really easy, but also like really fast while still preserving the reasoning behind the content. One piece of feedback that felt really meaningful, actually coming from a director of Michigan Department of Health and Human Services, they told us that we are following your flow and the visuals because they are so digestible. And we are adding our branding and decisions. That was just really affirming because it reflected exactly what we hoped for that these templates would do. The states did not need to start from a blank page. The structure, the flow, the visuals, the core content, everything was already there. So they could just focus on adding Michigan's own policy decisions, language, and branding. And Michigan has already used these materials for their first session, which was really exciting in the series. And we heard over 500 people participated in that series. There was really positive responses, and now they're preparing for their second session. Communication alone cannot answer every question community partners receive. They also need a more practical way to understand how the policy applies to different people and household situations. So that brings us to the next resource that Kayla will walk you through.
Thank you so much, Vidisha. So now I'm going to talk us through the interactive guide that we developed here at Civilla in partnership, again, with MDHHS and with those community partners that we spoke to here in Michigan. So first of all, why build a tool like this? Again, one thing we heard consistently is that residents and community partners really need a reliable way to understand how these big policy changes are applying to them and their really specific circumstances. We know that policy is typically written for populations, but residents need personalized information that speaks directly to them. So we wanted to equip community partners with the ability to respond to a real family or a real human that's sitting in front of them trying to get help through this policy. So one of the things we were really inspired by as we created this tool was this quote by a community partner from our co-design session. They said they were looking for a screener that's not a screener. And this really stuck out to us because we've heard a lot about how while screeners can provide a lot of information, they also have some big downsides. So for example, only being able to assess one household member at a time typically, which can make the process feel really repetitive and time consuming when you have multiple people in one household. Also, there's typically kind of a one-by-one question flow, which can sometimes be slow or frustrating. Residents also can sometimes end up screening themselves out and not even applying for benefits, even though they might be eligible, if they don't quickly see themselves in the questions or the language. So, for example, we heard from one community partner that sometimes people who have disabilities or conditions that would count as exemptions may not always see themselves as having a disability, and then screening themselves out of applying at all. And also, screeners can sometimes end up being sort of a black box. So for community partners, there's not necessarily an opportunity to learn about the logic or the policy going into the decision that it kind of spits out at the end. So they don't really always know why that decision is coming out. So the tool that we created is a policy-informed digital interactive guide, or the DIG for short, which I will be digging into. And it was informed by both community organization staff in Michigan, as well as insights from MDHHS and real state implementation thinking. We really wanted to make sure that this was something that felt like it could be implemented. So we worked really hard to ensure that it's reflecting the updated CMS guidance and the new policy that was in the interim final rule that was released on June 1st, which I'll talk a little bit more about later, while still meeting the needs of the actual people who are on the front lines of the policy and, again, the residents themselves. And we really see two use cases actually emerging from this tool. The first is actually helping navigators get more familiar with new policy and some of these really specific rules as they use the tool over and over and get more familiar with this language and the things that they're seeing. And then second, helping community partners, again, give residents that personalized Medicaid work requirements guidance based on a specific household situation for folks who are sitting right in front of them. And I do want to reiterate here, we really designed this tool to help navigators guide residents and for repeated use as partners become more familiar with the tool. It wasn't specifically created for direct resident use on their own. And when we did some early testing with residents just to see, it did reflect that, as some individual residents didn't fully understand the tool as they went through it. So we just wanted to reiterate, it's really meant for navigators as they help residents go through these new rules and processes. And we heard some really great feedback about the tool. One staff member said, "This cuts the work in half." I'm really in love with the workflow tool, to be honest. I think that that's going to be a godsend for us. We also had another staff member who started out really skeptical of the tool in testing, and also was really skeptical of using technology in her workflow in general. But by the end of the interview, they were so excited that they really wanted to see the DIG tool integrated into their workflow, which tells us that this tool really is meeting a key need, especially in this time of change. So now I'm actually going to jump into a quick demo just so we can show you how this tool actually works. So I will go ahead and share my screen. And hopefully you're able to see this as I go through, but I just wanted to start with a really quick overview of the tool, and actually I'll refresh. So as you can see here, we start with a couple of disclaimers. We just want to make sure folks know that this is not a determination or an application, and give folks a few more places to get information if they need it. And this is also an example that's designed for a generic state, so an actual state's information would be plugged in here. So I'll say I understand and continue to the tool. And it also is letting people know that this tool doesn't save any information or send it to the state. Now you can see here, I again have those same disclaimers, which I can collapse. And it starts with household members. So this is a key part of the tool. You can actually add multiple household members to reflect someone's actual situation. And then you go down into these zones. And this first zone is really meant to help assess if someone is on the expansion plan to begin with, so whether or not work requirements would apply at all. So we've got a few questions, as you can see, listed under there. Then the next two zones are assessing exemptions and potential exemptions. So this first one here, this first set is assessing health-related exemptions. So again, you can go through these health-related questions to see if any apply to the person that you're talking about. And then the third one here is general exemptions, so those additional exemptions that would count. And then finally, this fourth block here helps assess if someone is already meeting work requirements through any of the different pathways. So for example, household income, also student status, and then finally, it gives some information about additional ways that people can meet the 80-hour work requirement. So that's a really quick overview of the tool. And actually now I can go through and give you a quick example. So we can use my colleagues. I'll say that this is a 3-person household of Rachel, Ciandra, and Vidisha. And we'll start with Rachel. So we'll say that this is a household that I am familiar with, so maybe I know a little bit about them already. And we'll say that I know Rachel is older than 65. So I'll go ahead and click this first one. And as you can see, the summary panel over here on the right is live updating based off of what I clicked. So it's letting me know that she's in one of the groups that wouldn't be on the expansion plan, so work requirements really would not apply to her. If I wanted to, the guide is really designed to allow navigators to use it however they'd like. So I can go ahead and click more things if I want for Rachel, but because I'm seeing that, I'm actually just going to move on to Ciandra. So I'll click over there and look at Ciandra, and I'm going to say I know that Ciandra is on the expansion plan and that none of these apply to her. So I will go ahead and click this one down here, that this person is likely on the state expansion plan. I'll scroll down. And I know again that none of these health-related exemptions apply to Ciandra, but let's say that I do know that Ciandra is already meeting SNAP work requirements. So I'll click on this one. And this actually is a sub-question because there's some interesting policy intricacy here where it does make a difference whether Ciandra is required to meet SNAP work requirements or if she's exempt. But I will say she's already required to meet them or meeting them. And now I can see here again on the live summary panel that it's showing me that Ciandra would be exempt from work requirements based off of the information that I've selected for her. Again, if I wanted to, I could go down and answer more questions for her, but based off of that information, I'm actually going to go down and click next so that we can see Vidisha. So for Vidisha, similarly, I know that Vidisha is on the expansion plan, and I also know that none of these exemptions apply to Vidisha. So I'll go ahead and click none of these apply for both of these zones. So now we have the work requirements section here, zone 4. And so for the household question, household income, I'm going to say that I know that Vidisha is earning below 580 per month. So I'll put no for this question here. Does this household make at least 580 per month in income? I'll scroll down through student status. I'll say I already know that Vidisha is not a student, but I do know that Vidisha is completing some of these activities that would count as qualifying activities. And for this section, when you click, you can see that there's a little bit more information that you can see below the specific title. So I know that Vidisha does about 50 hours of unpaid work. And I also know that Vidisha acts as a caregiver that counts for about 30 hours. So now I can see that Vidisha is meeting that 80 out of 80 hour work requirement for the month. And I can see over here that the summary panel has updated to say that this person is meeting work requirements through 80 hours or more of qualifying activities. So if I'm all set and that's all the information that I wanted to add, then I can go here and this button does the same thing, and I can get their summary and next steps if I want to have a record of what happened here in order to give or pass on. So as you can see here, this summary goes through what was selected in the tool and gives some additional information about next steps. You can see that it gives the date it was prepared, and then you can see that it's reflecting the choices that we made in the tool. So for Rachel, those work requirements don't apply, and you can see here that it's listing why. It's also telling her that a next step would be to report if there are any changes. For Ciandra, you can see what we selected is reflected under her name. And then finally, for Vidisha, we have the same thing, which is telling us the hours. I will also note that currently the tool is designed for a 1 month look back period, and that's something we're continuing to explore, but that is reflected in the language as well. So as you can see, there is a lot that an organization staff member would need to be able to hold in their head for every different family scenario. This is hundreds of pages of policy that we've really worked to try and break down into something digestible so that policy becomes actionable for those folks on the front lines, helping serve people who might not have another way to understand all of this complex policy and apply it to their situation. Now, if you are feeling ready to make your own custom version of this, we have a tool for that too, something you can dig into. And I promise that's my last dig pun. This is the dig generator that we've created. This is also live on our website. But as you can see here, it has a place on the left side to actually put in your state-specific information. And then the live preview on the right side of the screen will update based off of that. So let's say that I wanted to put in Michigan here. As you can see, the applicable places where that information is, we'll go ahead and update right in that live preview so you can see what changes are being made and edit it to make sure that it matches your state's information. Scrolling down here, it also has the ability for you to add or change some of the brand colors to match your state's branding. And then a couple of policy choices, including the state FPL threshold for the Section 1931, and some other state policy choices here, as well as additional customization options. So we've worked to make sure that some of those key policy choices are really easy to toggle. And then at the end of this, you can go ahead and download a policy review document and the final HTML that you could upload onto your state's website. It does not have any login, any back end. Again, we really wanted to make this as easy as possible to potentially implement for folks. So again, that is already live on our website if that's something you'd like to explore and try out. So I'm going to stop sharing my screen here and we'll go back over to some slides. Perfect. Thank you. So again, this is just a link to the dig and the dig generator. And we really did work with Michigan to inform these tools. And they're currently actually working to operationalize their own version of the dig, which is really exciting. And we know that some other states are also starting to explore the generator to create their own. And so I'm going to pause here really quick. I know that we've already gone through a lot, and I think I see some questions popping up, which is really exciting. But we wanted to just spend a few minutes before taking questions now, talking folks through the changes that we've made to our application templates to reflect the recent interim final rule released by CMS or the IFR. So just a quick grounding for anyone who isn't familiar. Earlier this year, we released a set of application insert templates that states can use to assess work requirements at application. We know that every additional reporting step becomes another point where residents can drop off, even when they're eligible and doing everything right. And additional steps can become a real burden for state staff as well. So these templates that we released were really meant to help states get all the information they need for Medicaid work requirement at a touch point that already exists. So the previous versions of the templates were developed before the new policy details were available. That's why we've updated them to reflect the most current information in the interim final rule while preserving that original resident-centric design. We worked with some amazing folks as well at CBPP, so thank you so much to them to really ensure that these updated templates are still meeting those policy requirements. And so now I'll walk us through some of the big updates we made to align. But just as a quick refresher, the four decisions, actually, if you go back, Rich, the four decisions that shaped the application template design that we've stuck with are designing around a 1-month look-back period, accepting self-attestation for verifications, which we now know will be allowed at least throughout 2027, adopting all the state optional hardship exemptions, and then finally communicating policy to residents outside the application, as opposed to trying to capture and add all of that nuance and complexity right into the app itself. So now what's changed? First of all, we've updated from a 2-page template to a 3-page template. And this is to really help us incorporate the additional questions and language that we needed to add based off of the IFR. We also now have 2 different versions for different state section 1931% FPL levels. So basically, if you want more detail on that piece, the section 1931 piece, we have additional detail in the policy guidance document where you can read all about that. But version 1 is really for states that have a threshold above 32%, and version 2 is for those states that have a threshold below 32%. Next, we added the phrase makes it hard to work for the 4 medically frail questions that this applies to, because we know from the IFR that they added this condition for medically frail conditions to count. So that is now in our question language to reflect that. We also added a question about things applying last month, which helps assess the look-back period. So if folks don't have something that applies currently, they can still potentially be exempt for a 1-month look-back period if it did apply last month. So that question helps assess that. We also added this month, last month, or both option for questions that include the state optional exemptions, student status, and income, so that states could also have the option of future dating coverage when it applies. So for example, if someone is meeting the income threshold this month, then the state could potentially future date coverage to start next month. And then finally, we added additional detail throughout the application template inserts to help residents understand when something applies to them and help them see themselves with the additional detail that the IFR provided. So this is just one example of that, where we added some additional information on community service and unpaid work, as well as some additional information for part-time students about how to count their credit hours if that applies to them. We really wanted to make sure that any of those helpful details made it in as much as possible, so it made it really easy for residents to assess themselves as they go through these templates. So I know that was a lot. We have a lot of resources available. We have resources for the paper application, the online application, and again, that policy document that I mentioned that can help give further detail and explanation if and when it is needed. We're also working on other ways specifically to make implementing the paper application template as easy as possible. So if you're a state organization and you're interested in learning more or thinking about implementing that paper application template, we would love to hear from you, or if you just have feedback on implementation barriers in your state, we'd love to hear it. So please don't hesitate to get in touch. But with that, I am really excited to jump in to our Q&A. So I'll hand it over to the team to start that, and we can kick that off.
Awesome. Thank you, Kayla. And thank you, everybody. 45 minutes in for staying and listening to all of this content. The team has been so excited to share it, and we are really looking forward to getting to hear some of your and answer them. I wanted to just, before we jump in, that you can use the QR codes or the links here to download all of the materials that you saw in this webinar and maybe a few more. But we'll start by answering some of the questions that have been coming in through the Q&A in the chat. So the first is the DIG mobile friendly? And I wanted our teammate Vidisha to answer that.
Thanks, Rachel. That's a great question. Yes, Dig is mobile friendly, but we are not recommending it to be used in mobiles because it was designed for community partners who are like using it in their office, sitting with a resident and going through it together. On the desktop, it just gives more flexibility. Like you can see the questions, you can see household members, you can see how Kayla was showing summary updating in real time. So you can see all of that on the desktop. But on mobile, the experience is pretty limited of what can you see in once. But if community partners are already aware of this, how it's being used, the features, they can use it on mobile if that's available, and if they're supporting residents, it's okay once they're trained and know more about the tool. I also quickly want to share a little bit more about the fact that DIG is designed for community partners and why that's happened. Mobile was a big reason. When we tested with the residents, a lot of the residents were using it on mobile, and that was giving them limited experience of what the tool is. And given that residents use mobiles a lot, it's not the experience. They will not get complete experience of the tool and how the updates happen in real time. Another thing we also heard of why we're not recommending it for residents is that they struggle to navigate between household members. As Kayla was showing you how we can add multiple household members, that was harder to navigate for residents, and they were adding all information about the entire household under one profile. And one thing we heard during research also was how the tool is made and the questions are drafted is that community partners wanted as much information and details as much as possible up front. And they wanted flexibility to see everything so that they can just look through the policies and what's happening and look through all the entire household details at once. But for residents, they were looking for more like a guided experience. So they wanted more like simple, like how like they can just go through question by question and understand what they need to do next. So while the tool was easy to use for residents as well, it was just unclear for them of like what the purpose of it is and what actions or next steps they need to take. So just wanted to just add a quick snippet on why we recommend this for community partners and mostly be used in desktop unless you're trained and already know the tool.
Awesome. Thanks, Vidisha. And the next question, Kayla, this is going to be for you. We got a question earlier. What software did you use to build the tool? And we answered that a combination of Claude and ChatGPT. And there was a question, so Claude built the survey versus Google Forms or something else. Can you just talk a little bit more about how we built the tool and how it was used to help write the code?
Yeah, absolutely. So yeah, one caveat I want to give is that there is no AI working in the tool as it's assessing. So everything is predetermined in that sense. So if I click on one thing, we've set it up so that what you see is based off of that. It's not like an AI in the HTML file making a determination or a decision. But yes, we used AI, so Claude and ChatGPT to actually build it and structure the logic and make sure that everything was making sense and going smoothly. And that was definitely an iterative process process. And it was also really informed by the language and the learnings we had making the app templates and all of our other materials and resources as well. So we were really able to take a lot of that user-friendly language that we had developed and tested with residents and partners and apply it to this tool so that we were making sure that that experience was the best possible experience for folks trying to understand this nuanced policy. And again, trying to look at the things that are relevant to them at any given moment, as well as we really wanted to prioritize giving community partners a lot of control over the tool and how they wanted to use it, because we know that their workflows can look really different, and we know that they can work at their own pace, especially as they get more comfortable with the tool. So a lot of that kind of open structure that we made was really to allow for that and to allow them to use it in the ways that they see most fit to help serve their clients. And again, to learn the policy and the nuances of all of the little things.
Awesome. And before you go on off mute, Kayla, I think there's a related question, and I want to make sure I'm understanding this correctly. So if you ask this question, you want to add some details, please do. But someone asked if someone wanted to check the specific relevant policy language behind a given assessment from the dig tool, does the tool allow that?
That's a good question. Yeah. So currently the dig tool does not link specifically to language from the IFR or the actual policy. We do have a little bit of that in the policy document that we provided with the application template. That's probably the farthest our resources would get you to really understanding the mapping of a specific policy group that was listed in the original policy or the IFR to now how we're translating that into a question that we ask somebody to assess that circumstance. So if folks wanted to take the tool and add that capability to it, we would be so excited to see that kind of adaptation in the wild. But currently, we don't necessarily map the specific policy language. And I think that was also really a choice, again, about who we're designing for and trying to help folks understand the policy without necessarily overwhelming them with information. Great question.
Yep. I will say I'm also managing a few documents here as we're trying to ask questions, but I'm not sure if Kayla, you said that we do have the policy guide for the IFR. Did you mention this?
Yes. Yep.
Okay, great.
That's great. Yep. And
All good.
it has been
Yes, yes.
updated for the IFR. So great call
Yes.
out. Thanks, Rachel.
Yep. Awesome. Okay, next question is it sounds like you've created some good things for community partners, but what else is needed? And I think this is a really great question. I think one of the most important things that we heard is that community partners need to be educated about how to, as Vidisha mentioned, how to make policy personalized, and that the timing is really important. And so I think training folks ahead of time, whether that is through these materials, or there are other materials your state is already in the process of developing, getting those into the hands of community partners before residents are finding out about this policy is really, really important so that they can be proactive in servicing them versus reactive. We really want to try to help minimize the number of calls going to states and clogging up the phone lines for questions that could have been answered if education had been there. Another thing that we have been thinking a lot about is just that in most states, this policy is not live yet. And so things will come up and new needs will emerge as the policy rolls out. And for states having a pulse on what community partners need, or at least some way to be in conversation and have connection to be able to hear those needs, they will be able to lift up what they're hearing from different populations, from groups of residents, so that the states can adapt and make sure that they are really meeting folks' needs so that they are not falling off of Medicaid for procedural reasons. And I think there's one other question in the chat from Michelle saying, I'm worried about what happens next. For example, if someone says they earn greater than $580 a year, so the dig says not subject, what if the state does not know that? What are the next steps for the community partner? Yep, great question for a month. Kayla, do you want to take this one?
Yeah, absolutely. That's a great question. So the language currently, especially that would be in the summary and next steps, would be for residents to ensure they report. So for the community partner specifically, it would be to help make sure that they're guiding residents to report that information. Again, the tool is really meant to help them guide residents toward what they should do next, and that's a great piece of it is it would be report this information to the state to ensure they know, report changes if something happens for a resident situation. But that said, too, I want to also take the opportunity to note that we've tried to make different pieces of the tool really customizable to states, especially because we know that a lot of things are going to look different state to state, and we wanted to allow a little bit of that flexibility as you're using the dig generator to add maybe some more specific pieces. We know that especially for residents and community partners, the more specific states can be about processes or things that are coming up, the better. So there's also just some of that flexibility we were trying to build into the tool as well. But great question.
Awesome. If there aren't any more questions, I don't see any in the chat or the question and answer. We just wanted to really thank you for your time. Maybe we can give you a couple minutes back to explore some of the tools on the website and just say we really appreciate you showing up, caring about trying to make services that governments offer as simple as possible. And know that we're here if you have feedback or thoughts. We are wanting to continue to support states in rolling out tools that are helpful in reducing procedural denials. So please reach out. I think I have a slide here that says you can both follow us on our newsletter, but also if you have any questions, feedback, or need implementation support, feel free to reach out to Sam or myself, and we'll make sure to follow up with you. Thank you again.
Thank you so much.
Thank you so much for joining, everybody.
Thanks, everyone. Have a great day.